Christian, and I have been working with a Christian organization. When we are in the churches, we help people spiritually, but we don't do much in their physical well-being. But now, of which Edirisa actually is focusing on, to see people's lives physically improving. We are not only taking people to heaven, but we want also people to enjoy heaven when they are still here. Edirisa UK is basically a charity organization, and it is an organization that is helping people like special needs, disabled people, and also the women. Women here are very disadvantaged, and we help women through crafts, and also children, schools. We also have water and sanitation program as well.
I set up a proper charity because I realised I couldn't fundraise under my own personal name. So with a combination of my funds and some fundraising that I did, we built our first nursery school, which opened in 2006. And from there, it went on from one thing to another. I thought education was the most important, and then I decided clean water was also important, and health was important, and we grew from there. And in 4 years, we had 4 nursery schools. We had started a special needs centre. We were fundraising for a clinic.
We have a clinic in Bwama that the outpatient wing was built by Edirisa UK. So many times, people who are really behind, the poor, the people who are poor in the villages, you find there is a lot of problems with the access to medication, and medication sometimes is very expensive. You find that there are many people waiting to find a doctor. So that is one of the problems, and the government doesn't have organized places like rehabilitation centers where you can put them. So that's why sometimes it is good to intervene in that.
We have the number of services we offer here in the health facility. We have the general outpatient immunization. We have the dental services. We also do minor surgeries done by the Slovenian doctors.
I started to realise that I couldn't carry on funding all of the projects just by raising money in the UK, and I realised I needed to employ more staff in Uganda, more local staff, and I had to start changing the way we were doing things because we couldn't be dependent on overseas aid forever or on my contributions to the charity. We now have no international volunteers actually working for us. We have 38 local Ugandans in the various projects that we have, and I think probably 15 of those are working in one way or another with our craft section through being shop assistants, tailors, and we have 100 women in the craft groups that we are training and working with. Some make baskets, some make earrings, some make sewn products, and we're now in a position where the profits from the craft section are supporting our special needs centre.
We make a lot of things out of kitenge fabric and PV. These are dressing gowns, bags, shopping bags, backpacks, wrapped skirts, relaxing trousers, and all other kind of things we make. And we also go out to teach in the women groups that belong to Edirisa UK.
For the schools, actually we have, Edirisa UK have 4 nursery schools. So the 2 schools are around the lake, and the other 2 schools are also in the Buchinda area. But also we have special needs as well. So special needs education center is in Chitanga. That's the boarding school, and for them the age is between 6 to 20, even 22. We have around 60 kids there, and a number of them who are mentally retarded, others are physically handicapped, and others are deaf. In Uganda, disabled people are really very disadvantaged because we don't have organized homes where they should be. And in most cases, when a child is born and is handicapped or he has some kind of a disability, that one is neglected by the family. There are many stories whereby we had even some of our kids where we got them, they were even tied, in the home they were tied on poles like goats. And then you get a kid from there, you put that kid in school, and you find they began to learn things like using a toilet, because they have never used those things before. So that's why it is very important sometimes to have a school like this one.
The role of Edirisa here, actually, it's very great because it has done a wonderful work, especially in infrastructure development of the center, with the welfare of the children, because it has provided sponsorships to the children, it has provided some other monies. So really it has done a wonderful job as far as special needs here is concerned. We offer education to the physically handicapped children. We offer education to children with hearing impairment. We offer education to children with autism and those who are epileptic, those who have multiple disabilities, and those ones with mental retardation. Children with hearing impairment are taught sign language so that they don't get difficulties in communication. At this moment, we have 8 teachers who are trained in special needs, and we follow the Ugandan syllabus, the Ugandan primary curriculum. There is science education, we have mathematics, we have social studies, and also English language. Then alongside, we equip them with vocational skills in carpentry work, tailoring and garment cutting, craft work, and some other minor skills.
Edirisa is the Bachiga word for a window for the world to see Africa and for Africa to see the world. I'd like to see a lot of love and happiness and compassion through that window. And on the other side, I'd like the people in the Western world to see what I see when I go to Uganda, which is a hopeful and happy people who generally are hardworking, and it's not the corruption and the AIDS and the starvation and the wars, because that's not Africa to me, and it's not Uganda, definitely.